All right. Good afternoon, everyone. My name is Tiffany with Latan. Welcome to today's webinar series, Using Assistive Technology to Manage Life Staying at Home. Today's webinar is Assistive Technology Prevention and Protection Protocols. Susie Stewart will be the presenter, but before we get started, please enter in your parish and organization in the chat box. While you're doing that, I'll let you know this webinar is being recorded. Today we have 30 minutes scheduled. We will have time for questions at the end of the webinar. Your microphones will be muted throughout the webinar. If you have a question, you may enter it in the chat box at any time, or you may wait till the end of the presentation. Closed captioning is provided. To access closed captioning, on the bottom of your toolbar, you will click closed captioning. And with that, I'll hand it over to Susie. Susie is our Senior Director of AT Services with Latan. Susie?
Tiffany, thanks everyone for joining us this afternoon. As Tiffany said, our presentation today is about assistive technology prevention and protection protocols, safely access and maintain devices to help you live the best life now. Just to share a few objectives and goals for today, some of the things that you'll be able to take away from our presentation is that you would learn about services and how they have been adapted so that you can still get the devices you need while maintaining social distancing. Also, to learn about ways to keep you safe whenever you're receiving shipments of assistive technology devices you may order, and also how to, or picking up devices, and then also how you can effectively clean and maintain your devices to limit your risk of exposure and transmission. So just a little quick refresher about assistive technology and what it is if you're new to the assistive technology. Basically, I think assistive technology helps people with functional limitations and disabilities live their best life, because there's all types of technology available out there that can help individuals that see, hear, talk, learn, and remember. Also things that can help them to groom and dress. Important now that more than ever is to be able to interact and socialize when we can't directly be together. Also, there's plenty of things out there that help people prepare and eat their food, people to be able to get up and get around, and also work a job or participate in school and stay connected with family and friends. So some of the protocols that we're going to talk about today are how to access the different AT services and get your equipment. Also, how to effectively accept devices through delivery or pickup, and then how to care for your devices and equipment when you're going out as we start to open our state. So first, the way that we have, and Latan is the AT Act program for the state of Louisiana. So there's a program for every state in the country. And all of our programs have kind of pulled together, as every organization has, to find ways that we can deliver the services that we have and also help keep people safe and maintain that social distancing. So our rehab department, we have occupational therapists on staff, and we do telehealth appointments, and that's set up. So individuals that are needing services for OT can definitely participate in our telehealth appointments. Also, we are conducting virtual demonstrations right now. Currently, our both our demonstration centers are closed to the public. However, we are all still working, and our AT professionals are available to help people to have access to the devices that they're looking for or want to learn about through virtual device demonstrations. So if anybody's interested in participating in those, they get the option to look at the devices that are, or see all the devices that are available, and to be able to compare and contrast their features. All that can be done online. Moving to some of our other services, we are still conducting device loans, so people can still borrow devices. We are set up to sanitize our equipment per healthcare protocols, and so we are able to still do device loans, and we still have devices that used available on our AT marketplace from Latan that people can access. And also through our leasing program, people can still lease equipment. Also, we are working with people that are working for financial loans and helping them through phone calls, get their paperwork together, fill out applications, any assistance they need there. And as we move forward, so what's important about assistive technology and being able to have those demonstrations virtual for now, and once we open back up as a state, we're able to do face-to-face, is that it gives the person the opportunity to learn about all the different devices available. Also, they get to compare and contrast those features. They get to experience the devices firsthand. They also can learn about the different features and how each one works differently, and then they can investigate that and determine how effective and usable it is. So the purpose of the device loan is so they can borrow it in their own environment, and when it's in their environment, they can actually see it functioning. And we've all understood that everything is great in theory when we see it in a catalog or online, but when we actually get it there, making sure that it is effective and usable before we make a final purchase. So our next slide. So let's talk a little bit about receiving a shipment of AT devices. And I know this has been, you know, kind of on the forefront of everybody's mind when we're thinking about all being safe and how to take in items, especially when we have to still purchase groceries, whether we do it through pickup services or have it delivered, or if we have a package delivered because we're ordering more items and trying not to get out as much. You know, these same kind of protocols or guidelines is great to follow to protect yourself. And so through our program, or if you're getting equipment from other service providers, DME providers or anything, it's important to know that that you want to confirm that the devices that you're getting are either new and untouched in the manufacturer's box, or if they have been handled, or they are loaner items, or they're used equipment, that they are being properly sanitized with an approved disinfectant. Generally, per the guidelines and regulations for healthcare agencies, as well for Latan, that we follow the sanitation guidelines that are put out. We have disinfectant that is used and approved that kills viruses and bacteria, and that the sanitation stays on that equipment for the needed specification of time. And then those items are bagged into clean bags so that they can be shipped out or picked up by an individual. It is recommended, even though the sanitation is done, that because in transport, other people are touching these packages, that if you receive a package via shipment, or even if you're picking one up, that you would leave that package isolated in an area for a minimum of about 48 hours. This helps us assure, especially with there's still so many things that we do and don't know about this virus. But it is thought that after 48 hours, anything that is there on that would be not able to live anymore after the 48 hours. So that is per the CDC. Also, accepting loaner and used AT devices. Of course, Latan is still operating their AT marketplace online. However, there are a lot of items that are available through Latan that we put out through our marketplace, but there are still people doing person-to-person exchange. We do not necessarily recommend at this time that you would do that because of the current risk to exposure. However, we also understand that there are people that this may be the only way that they would be able to get these devices. Otherwise, they would not have access to the device. And so if they are in a situation where that's their only option, then we, and there's a link here, and the link is also in the chat. And so if you want to access this link, this gives you a link to the CDC's website and really tells you about cleaning and what you need to do when you're bringing things in, if you're doing a person-to-person exchange of any items. Next slide. So I also want to talk about equipment pickup. And again, like I mentioned earlier, Latan has suspended its face-to-face until May 15th as of right now. Of course, this is a day-to-day thing. And so that date may change. But as of now, we are still on plan with the May 15th date. And we have revised our procedures during that time that people can still loan a device or lease a device from Latan. And so to do that, we have altered our procedures, and the procedures you see here. Basically, we would handle any remote interaction any interaction that we need to do is going to be handled remotely. So for requests, whatever paperwork that needs to be done will be done on the front end remotely. And then we would schedule an appointment. We ask individuals that are coming to pick up anything that they would remain in their vehicle and call the Latan staff when they arrive. And also make a space before they get there, a designated space in their vehicle, preferably in the back part of the vehicle, a trunk or in the rear if it's a van. And have space for whatever equipment that they're picking up. So it can just be placed in there. The equipment, of course, will be sanitized and loaded, packed in a clear bag, and loaded by staff that would be wearing appropriate PPE, which includes gloves and masks to minimize their risk and to minimize the risk of transfer of anything. And then again, even though everything's been sanitized, it's still just recommended as an extra safety precaution to leave the item in an isolated area for the 48 hours before you unpack it. So now we're going to talk about unpacking your devices that you've received, because there is a little bit of a process here, especially if you're receiving shipments of devices. Because they have been handled by whoever in whatever service is being used, and different people have handled that device to get it to you. So when it's delivered to you, first of all, you want to remember to wash your hands, sanitize them. If you have access to some disposable gloves, you would want to wear your disposable gloves to handle the box and bring it in. And then you want to open up your box, pull out your packing, and then stop and not handle the device or equipment itself, because you want to wash after you've touched the packing and all that. So you're going to wash your hands again or sanitize them. And then you're going to pull your equipment out, and then you want to dispose of that external packing, clean any surfaces that it's touched or anything like that, wash your hands again, and then begin to handle your devices from that place. So when we talk about hand washing and the art of clean hands, I love to share about clean hands. I've been in the medical field for 20 plus years, and how we learned in the hospital to do that 20-second hand washing was to sing the happy birthday song twice. So hum it, sing it to yourself. That lets you know that you're actually spending the time you need to wash your hands. There is some links. I pasted a link here to the CDC website about hand washing, and I put two other links that are in the chat to the WHO is recommended, because there's actually a process there that's recommended where you are making sure that you're washing your hands front, but there's also a process where you do your scrub your fingernail beds and your cuticles, and take the time to wash around your index finger, all your fingers. And then if you do that procedure, then that gets you that full 20 seconds too. So there's tips and tools to wash and make sure you're washing good. I've actually been teaching my little grandson how to do good hand washing, so he gets super excited about it. Kind of funny. But it's just one of those things that not to be in a hurry, take the time to keep yourself and your family safe. Also, if you don't have access to soap and water, and you can use an alcohol-based hand sanitizer. There's a rubbing protocol or procedure that you can do as well that's in the chat. And it's important to make sure that you double check any hand sanitizer that you buy, which I realize has been hard to find at stores. But make sure that your hand sanitizer is 60% alcohol. So another thing I wanted to mention about durable medical equipment, which is actually assistive technology is basically an umbrella term, and durable medical equipment falls under that. And there's DME companies out there, and they may be taking care of individuals who have had the virus and have been discharged from the hospital and may need equipment. Latan does provide some durable medical equipment, but also other service providers would be doing that as well. And some of the durable medical equipment that is coming out to individuals does require that a professional perform the setup. So it is important that when you're going to have someone come in your home to perform a setup, that you want to protect yourself and that person coming in. And so it's important that, and usually they will screen or ask you if you have been actively sick, someone in your household has been sick, or you've been asked to quarantine or experience any symptoms. And then you want to make sure that you report that to them so they can alter the way they deliver their services to make sure to keep you and them safe. And then also to maintain that social distancing of at least 6 feet apart. And I know that we've been talking about this for a good 6 weeks now with in the news and on television, and you hear all this 6 feet apart social distancing. It's so important. And so for the few times that I've had to go out, and I still notice that people tend to not know what 6 feet is, or they forget and they get to talking to somebody and they move in a little closer. And that is just human nature for all of us. So I always tell everybody, try to identify with what 6 feet really is. It is one of the, items or things that you can look at is the distance between or the length of a twin bed. So from one end from the headboard to the footboard of a twin bed would be about 6 feet. Another example would be a mid-sized sedan vehicle. It's the width of it. So from one side of that car to the other would be 6 feet, if that can give you a good idea. But it's a little further than sometimes we think, and also what we're comfortable with when we're talking to somebody. So it's important to try to be aware of that. Also, it's important that when the service provider staff comes into your home, that they are wearing personal protective equipment, a mask, gloves, and gown generally is what individuals would do when they're coming in. So let's talk a little bit about cleaning your equipment. And this goes for, first of all, I always want to say, and this is recommended by CDC, but it's also by anybody, that you want to follow the manufacturer guidelines for cleaning. You should receive some type of guidelines for cleaning that equipment and keeping it clean, especially if it's items that are going inside and outside the home. So if you still have to leave your house to do essential things, then your items are being exposed to whatever's out there, and you need to clean them when you come back in. And so that's important to do, especially if you're using a tablet for speech or you're using a mobility aid of any kind. Because again, there are plenty of people out in the world that are not wearing masks that may feel fine, but could be carriers of viruses. And so it's important to clean those devices when you get back in. So one of the things I want to point out is electronics. A lot of times people are kind of fearful about electronics and about cleaning them, but generally in most cases, items, and again, you're going to follow your manufacturer guidelines, but electronics can be wiped down safely with disinfecting wipes. Of course, to reduce your risk, you definitely want to make sure that the device is powered off and not plugged into a power system to make sure that you don't have any risk of being shocked, or of, if the device is turned on and the liquid were to get into it, it can harm the device and also, void your warranty. It's also important to make sure that you don't ever submerge your electronics and don't oversaturate any of the open port areas. So that's important, and make sure that if any liquid is pooling on it, that you want to wipe it down. Also, if you have, access to or have already got your device in a case or have a cover protector, those items can safely be wiped down. Generally want to be a little bit more protective of your screen if you don't have a cover on it, but it is ideal to have a cover, and you can use disinfectant wipes on the screen. So also a lot of other assistive technology, be it kitchen aids, most of the time parts or all of those kitchen aids are a lot of times dishwasher safe. Again, you want to check the manufacturer. Also, anything that uses fabrics like slings or other items should be able to be safely washed. It is recommended on the hottest setting of your washing machine, but it's also CDC recommends that it is follow the manufacturer guidelines. So if it is mandating a cold water wash, you still want to cold water wash it. But if it says you could do up to warm water, then you would want to choose the highest setting for that. Also, hand washing before and after the use of your equipment. So when you're coming in and cleaning it, you want to wash your hands, clean your devices, wash your hands again. So just protecting yourself and your family. There is a lot of good information out there now. I just have a picture on the slide of basically there's different flyers, but it's not only learning good hand washing techniques for yourself, but encouraging that for your family members and reminding everybody, because this is going to keep yourself and everybody safe and from acquiring any kind of infection. It's also really important to learn and think about these things, especially for people who are at higher risk for contracting the infection and having poorer outcomes, especially individuals that have compromised immune systems, individuals that are aging or older, and individuals that may have problems with diabetes, obesity, heart disease. These kind of risk factors put those individuals at a higher risk of having poor outcomes with the current coronavirus, and definitely makes them an easier chance for them to get infected and end up in a hospital or something like that. So it's important to practice this good hand washing. Some other things that we can do to help us keep safe are the social distancing. And of course, I don't know if anybody else had ever even heard that term before the coronavirus came around, but I hadn't. And so this social distancing that we're all doing now, again, I want to remind everybody that our state is soon to be opening up. The 15th is right around the corner. And even if we don't open up on the 15th, probably before the end of May or right at, we're going to be opening our state. And especially for people's health that is compromised, everybody's excited, everybody's ready to get out of the house and just go, go, go. But it's important to remember that the virus is still out there and it is still infecting people. It's not gone away, but so it's still important to try to practice social distancing. They also recommend that you wear cloth face coverings. I have had to go out recently in the last week or two for grocery shopping and noticed that only about 50% of people actually are wearing face coverings and really practicing that social distancing. But the virus is still out there, so if you are at a high risk, then you definitely want to practice these type of things to protect yourself and your family. So again, just some quick reminders. As our state begins to open, less people are getting sick, but the virus is still being transmitted. So you need to protect yourself and follow the guidelines. Also, it never hurts to ask. Generally, nobody ever really thinks about that, hey, I'm not 6 feet far enough away, or hey, I'm going to reach out and shake your hand, because that's what they've done for 60 years of their life. And now we're all supposed to elbow bump or stay away. So that's a new thing for people. So it's really important that it doesn't hurt for any person to say, hey, I'm wearing my mask, and can we stay 6 feet away, but I still want to talk to you, and thank you for all the help and all that kind of stuff. So it never hurts to ask anybody if you feel uncomfortable, or you feel like that they're a little too close, or anything like that. So this is a link down here that CDC has put out that is specific to people with disabilities and the aging population about how they can protect themselves and how they might be at higher risk for contracting the coronavirus as we go out into the world. So I just want to thank everybody for joining us today. And I want to remind you that our webinars are being recorded and they will be posted to our YouTube page soon. They're not there yet, but we are working on getting them posted up there. And our YouTube channel, all you have to do is do a search for Latan and Assistive Technology, and you should be able to find our channel and like us and subscribe to us. And as those get posted, you will be able to find them. This is just more information about our website and our phone numbers where you can contact us. And we also have our info@latan.org email that you can reach out to us. So I want to open up the floor for questions. If you have any questions, you can type them in the chat, or you can unmute yourself and ask away.
And while we're waiting on the questions to come in, I want to remind everybody our next webinar is going to be Thursday, May 14th. And that topic is going to be mindfulness, bringing calm and focus into your daily life. And that's going to be presented by Orhan McMillan. He is the founder of mindfulnessliving.com.